Living with chronic obstructive pulmonary disease often means living with a cough, and it can be hard to tell what is normal and when a cough truly signals a problem. You might find yourself wondering if today's cough is just another day or if it is something more concerning. You should worry about a worsening COPD cough when it changes significantly in frequency, intensity, or character, especially if it is accompanied by other new or worsening symptoms. This often indicates a chronic obstructive pulmonary disease flare-up, also known as an exacerbation, which requires prompt medical attention. The core reason certain cough changes are concerning is that they can signify an underlying infection or increased inflammation in your airways. For instance, if your cough becomes much more frequent, more forceful, or suddenly painful, it could mean your lungs are working harder to clear irritants. A significant change in your mucus, such as an increase in volume, a shift to a yellow, green, or rusty color, or an alteration in its thickness, points towards an infection. Similarly, new or increased shortness of breath, more wheezing, chest tightness, or unusual fatigue are all signs that your respiratory system is under greater stress and needs support. When you notice these worrying changes, the immediate next step is to consult your healthcare provider without delay. Refer to your personalized COPD action plan, which should outline specific steps for managing worsening symptoms. This plan often includes instructions on adjusting your medications, such as using your rescue inhaler more frequently or starting a short course of oral steroids or antibiotics if prescribed by your doctor. It is vital to communicate all your symptoms clearly to your doctor, describing not just the cough, but any accompanying changes in breath, energy, and mucus. Understanding your individualized chronic obstructive pulmonary disease action plan is a powerful tool. It provides clear guidance for specific situations and empowers you to act decisively when symptoms worsen, potentially preventing a visit to the emergency room or even hospitalization. Early intervention based on these established guidelines can significantly impact the severity and duration of a flare-up. Paying close attention to your body and recognizing these early warning signs of a worsening cough, along with other symptoms, is crucial for effectively managing your chronic obstructive pulmonary disease. Promptly communicating these changes to your healthcare team allows for timely adjustments to your treatment, helping you maintain better lung function and overall quality of life.